Radiotherapy involves using very high doses of radiation, and it's involved in probably about 40% of cancer cures. So it's a treatment that we use a lot. So a lot of cancer patients will have exposure to radiotherapy. And the radiotherapy can be used either to cure cancer or to improve symptoms which are produced by the cancer. So that might be shortness of breath, pain or bleeding. Radiotherapy involves using targeted X-rays to the area where the tumour is causing symptoms or could potentially spread. So when we're intending to cure a patient, the radiotherapy will be directed to the tumour, which is our target, and we need to try and make sure that we expose the healthy tissues which surround the target, which surround the tumour, with as minimal dose of radiation as possible, because that allows us hopefully to reduce the amount of side effects that a patient will have from treatment. So with radiotherapy, although we could kill the cancer with a big dose of radiation, we'll also kill off healthy cells. So we have to divide the radiation dose up into smaller doses. And a fraction is one treatment of radiotherapy. So for some patients, we may offer a course of treatment which takes a week, so involves 5 treatments which are given as a day case, or another patient may be offered 37 treatments, for instance, and that's again given typically as a day case, so that would be 37 fractions, and typically a fraction is 1 treatment a day. So radiotherapy is high-dose X-ray treatment. So when the patient attends for radiotherapy, it's just like having an X-ray taken, so the patients don't feel any different. So it involves them typically coming into our department for a CT scan, and that will be used to plan their radiotherapy treatment, and that may be delivered later that day, or it may be delivered up to a few weeks later. When the patients attend for that first treatment or their first fraction, it involves them lying on a couch, and the radiotherapy machine will move around them and will deliver the X-ray beams, but the patients won't feel anything at that point in time. Sometimes, depending on where the X-rays are being delivered, it might be, for instance, to the stomach or to the spine. That might cause some nausea or some vomiting, and if that's something the clinical team feel is a risk of that side effect, then we will normally provide some anti-sickness pills for the patients beforehand. So there are some after effects of radiotherapy, but that will be very dependent on which area of the body the X-ray treatment is going to.
If you require any of this information in another language, please let the team know. And if you have any queries or questions, please speak to a member of your clinical team or visit our website for more general information about radiotherapy.